All right, thanks. Thanks everyone. Thanks Suli and Brajesh and everyone for having me. This is my second meeting with the group and I'm already up here, so I'm excited. Come in. Yeah. Excited to be here. Before I jump in, this endeavor is actually somewhat personal in the sense that it's all about clavicles. We're going to get deeper into clavicles than probably most folks would like. But I actually broke my clavicle about 15 years ago in a bike accident. And what they did then is what they do oftentimes still is they kind of send you home in a sling and say it'll get better. And at the time, my brother was a surgery resident. You'll see he was the other founder in this project. He was a surgery resident and met me at the ER and helped with some of the other injuries, but couldn't do anything for the clavicle really. So it healed okay, but as I get older, my right shoulder now is starting to kind of bend forward, and I'm told as I get older it's going to get worse, and I get a little more stiffness in my muscles in that area. So it's actually cool to be working on a project that maybe makes this procedure better and healing times faster. It was a 6-week healing time for me, and then really another 6 weeks before you could really feel comfortable doing what you normally do. With the advent of better clavicle procedures, although both of those windows should come down, return to activity, return to full activity. And so with that intro, jump in a little bit. The time is decent right now timing is good for a new clavicle innovation at this point. It still is, and it has been for a long time, the most frequently broken bone in the body, particularly for adults. And the frequency of ER visits for broken bones, this is the highest. The number of actual surgeries has increased 6-fold in the last 15, 20 years. And what's interesting about that is we've always been doing surgery on really bad clavicle fractures, multiple fracture sites and fragments. But in recent times, there's been an increase in outpatient procedures and an increase in, simple mid-shaft fractures like mine. And so we're seeing a trend up. However, the implants that are used are still kind of the older, clunkier implants that were originally designed for the complex fractures. They've just continued to use those. They haven't gotten much better. So they're a bit clunky and they have kind of high failure/removal rates. They're intended to stay in there in your bone for your life, but they oftentimes fail in different ways. So with all that, that's kind of why we decided to tackle this. A bit about us, that's my brother. He's now a full-fledged shoulder surgeon. He likes to joke that my parents didn't plan this. It just happened to happen this way. But he's now practicing at Kaiser in San Diego. He's Harvard trained. He'd be embarrassed if he was here, so I'll stop. But he's kind of made a name for himself in the field. My background is I was an engineer at Cal and then became a patent attorney. And so together we kind of decided to tackle the clavicle issue. This is part of our team that we put together for this project. And we're happy with it. But Akash has a finance background and has a small fund that he operates and has a strong business team that helps us on the business side. Brett Swope is an engineer out of Stanford who started a company in San Francisco called Swope Design, and they're a growing company that likes to help startups, and so they've partnered as an equity partner in the project. And Sabing Lee is one of the strongest medical device attorneys in the country. He's actually my old boss, and so he's been kind of our lead patent person on this project. So a few other folks that I haven't mentioned, but that gives you a flavor for the team we put together. And at any time, raise your hand. I can pause. Otherwise, I'll run through this quickly. But the market size is sizable. It's not like a multi-billion-dollar market, but it's already fairly sizable and growing quickly. If you look at this chart, the right side is actually mid-shaft fractures, which are roughly 80% of clavicle fractures. And the device that I'm going to show you today, our lead clavicle plate, is addressing those. Yeah.
Just a quick question. I'm curious why the rest of the world market is smaller than the whole U.S. market.
That's a great question.
Or US, EU, I guess.
Yeah, I mean, the answer is kind of what you would expect. Access to care. Well, it's access to care, and then for a procedure like this, where you can avoid surgery and still kind of be functional, it's one of those kind of situations. Yeah. But
sling is pretty inexpensive to
exactly.
describe. Yeah.
Yeah, exactly. And I think, and that's actually what kind of the last bullet, the rest of the world is actually growing faster because of the increased access to care in all these other regions. We didn't mark this properly. It's actually the US, EU, Australia, a few other of the developed kind of nations are in that top bucket. But yeah, that shows that kind of our current device is actually tackling a portion of the market. And then the projected growth is 10% per year for the next 3 to 4 years at least. So, how's that? All right, some pictures. These are pictures of kind of what a current procedure looks like. And the devices, even the current ones, they're not that big. They're like these long, thin devices, and I'll have a picture of them in a second. But the scar that you have to put to place those plates in, the actual incision size is pretty large. It's right here if you're doing the right side, and it's a fairly large incision. The amount of periosteal stripping that has to take place, basically the amount of extra tissue that's removed to place these devices is fairly high. And so the result is scars and sensory kind of nerve issues that aren't great, and slow healing time, which I mentioned. And then the removal rates, just the way these plates are designed, because they're long linear plates, they kind of have to be placed in one plane, and as a result, there's not much flexibility for the surgeon where they can place it on the bone, and that's one of the reasons why you have high removal rates. That's kind of a current picture. And one of the more recent techniques over the last few years that has popped up to kind of address this issue that folks have tested is called dual plating. And that's simply taking two of the current devices and putting them in the clavicle at different angles. And the results, the studies are out that leads to a higher degree of stability, less need for implant removal so far in the short term. And you can address a lot of fractures with those options with a kind of biplanar approach, if you will. The obvious disadvantages with two plates is you're buying two plates. You're putting in two now large plates, so they're sticking out even more, and the scars are even bigger. So you've made the procedure longer and more difficult. So that's kind of that's the setup for where kind of we came in with our X plate. And so my brother basically initially designed this. The idea is a single plate that has dual plating all in one plate. And this doesn't show actually the overall size, so I have the next slide. We'll kind of compare the size of our device with current devices, but we've gone smaller, thinner, and the key element is shorter. So we're actually going much shorter, which reduces that incision size. In this case, the shorter the plate, the length of the plate, the smaller the incision. And so some of the other key things is you can't see it so well here, but the offset, the two planes on either side are offset by 90 degrees, meaning like if you went around a circle, it's about a quarter of a circle, and that part sits on top of the clavicle, and it's kind of like a sleeve that sits on top of the clavicle. To be specific, the old plates are about 3.5 millimeters thick. This is 2.7 millimeters. And the screw holes, we're using smaller screws, smaller screw holes, and the idea is to keep this closer to the actual bone, and that leads to kind of better healing and less need for removal. The rest of the stuff is kind of, I'll probably jump into on the next slide. And this is that comparison. So that top one actually is a Synthes device, which is the biggest one on the market still for many years. And you can kind of tell that's contoured a bit to the clavicle, like a clavicle S shape, but it is still a linear single plate. That's a titanium plate. The second one is a stainless steel plate, purely linear. These are plates that are somewhat bendable, but that's pretty much how they go in. They bend a little bit. They'll bend when you actually drill a screw through one of those holes. And then that's ours. So quite a bit shorter, a little bit kind of wider, and it's rounded, kind of pre-curves.
What material is that?
That's titanium. Yeah.
Is there some flexibility or articulation of those joints? It looks like somehow they must move.
Yeah, that's a good catch. You're talking kind of about this area here and some of those. Yeah, that's part of our design, is that by being thinner, and actually we're even thinner on the edges. If you look at these outer edges, we go even thinner. So the idea is that the surgeon can flex those pieces a bit more to kind of make sure that it's flush where they want. And that's actually huge because everyone's clavicles are slightly different. That's one of the challenges here. in one of our upcoming challenges. Our remaining challenge is actually contouring our plate. So our final plate won't look like this. It'll actually be kind of contoured to the clavicle, and it will have different sizes, 7 to 8 different sizes as well, to address kind of the various sizes of clavicles. Talked about some of these. The main advantages here are kind of dual plating in a single implant. So we're keeping the cost the same as the current implant. And fewer removals, smaller incisions, and nerve damage. And the first one there is kind of more of for surgeons, but there's more options. If you kind of look at our plate, if you think of all the permutation of the different combinations of screws, yeah.
1 minute left.
Oh, cool, thanks, yeah. All the different options, then that's basically what's neat is that the surgeons will only use about 4 to 5 screws in these procedures. And so with ours, you have kind of a lot of options. Quick slide, too many words to read, but basically we've already shown this to a handful of shoulder surgeons in the field and gotten great feedback on the design. All right, and then our timeline. We started in 2016 on this project. Our first design was actually a titanium nail, which we filed IP on as well. We realized that even though it was a nice kind of device, surgeons prefer to use plates. So adoption would be much higher with a plate versus kind of a really small nail. We started with that in 2016. We started by actually surveying a bunch of surgeons, learn about what they felt about the current implants, and we designed ours in 2017, filed patent applications. And since we've also made relationships with most of the major medical device companies, we've gotten one offer to license already. And we built our team that I kind of showed you. And the plan here is a pretty short path to by the end of this year, we'd like to have this licensed out. And so we're currently raising $300,000. We just started that process. We're partway there. I'd like to finish that off. We have our engineering team to kind of create those 6, 7 different sizes I mentioned. And we're going to file the FDA application and hope to license by the end of the year. And
Great, thank you very much.
thanks. Yep.
Questions from the audience?
Yeah.
Has your firm or anybody on your team gone through the FDA process already?
I've been a part of it helping other companies do it, not for a company we've owned ourselves, but yeah, our part of our team, we have an FDA consultant that's all they do. So they prepare applications, and luckily in the orthopedic space, it's actually really easy. Like a simple titanium device is a class 2 device, and it's like usually a 3 to 6 month process.
And what about getting into the supply chain with the GPOs and everything like that? What's your strategy for that?
And that's why we're like dedicated to licensing this to an existing company, because they have the distribution network already lined up. So like if you look at the market for clavicle devices, Synthes has like 30%, Zimmer has 25%, and so we're in contact with all of them. Their feedback to us was if you get this to FDA with good testing and everything, we'll just license and distribute it. Yeah.